It's my great pleasure to introduce our Palliative Care Manager to you. Sheila has been with hospice for 3 years now, and beginning of end of last year, took up the role of Palliative Care Manager at a very difficult time, and has exceeded all expectations through the COVID pandemic, and has risen to the challenge presented to us by the challenges that we face at the moment. Sheila is married, has 2 very busy boys, as her description, and she has 13 years experience predominantly in operating theatres, both locally and internationally, and she is specialised in palliative care. She's here to talk to us this afternoon about metastatic breast cancer, palliative care, and how hospice can best support someone who has this diagnosis. So I'm going to just put on the share screen and things like that, and we'll hand over to Sheila this afternoon.
Thank you, Warren, for that introduction. Good afternoon, everyone, and thank you for joining us this afternoon. As Warren mentioned, I'll be chatting to you today about palliative care and metastatic breast cancer, and how Msunduzi Hospice can best assist you with, and also to share with you the services that we provide. We'll start about just discussing what metastatic breast cancer is. It is advanced cancer of the breast, also known as stage 4 cancer. This means that the cancer cells have now separated from the tumor, and they have traveled through the bloodstream and are now growing elsewhere. The common areas where these cells would travel to is primarily the lungs, the liver, the bone, and the brain. And from looking at this diagram, you can just start to imagine the symptoms that someone would be presenting with. Some of the symptoms that patients with metastatic breast cancer present to us is chest wall pain from that cells or new tumors that are growing in the lungs. You'll have shortness of breath, swelling of the arm on the affected side. Some patients present with constipation, and then some patients are actually quite fatigued. Most people at this time will seek the services of Msunduzi Hospice, especially at the onset of these unpleasant symptoms. Last week with Dr. Callis's presentation, he indicated to us that with the research that's been carried out in Europe, that early detection and palliative care, some women can live actually up to 5 to 10 years. The encouraging thing for us is that metastatic breast cancer is not a death sentence. So what is palliative care? Palliative care remains misunderstood by many and is often linked to morphine and the feeling that nothing more can be done. World Health Organization defines palliative care as an approach that improves the quality of life of patients and the families facing problems that are associated with a life-threatening illness. And when we say life-threatening illness, it's not just cancer, but there's other illnesses that can be attached to this broad definition. Through the prevention of relief of suffering in the early detection and impeccable assessment and treatment of pain and other problems, physical, social, and spiritual. From this definition, we see that palliative care is holistic care. So what are the goals of palliative care? Contrary to popular belief that it's associated with end-of-life care alone, this medical approach is about improving the quality of life from the time of your diagnosis, and also during your treatment and during the continuation of the illness. So it doesn't only focus on care at the end of life. The other goal of palliative care is that it improves the quality of that life. And quality of life is unique for each individual. And hence we also say that palliative care is a speciality that is client-centered. And it is a fundamental level of support to cancer patients and their loved ones. This quality of life is influenced by your physical presentation, your social, emotional and spiritual well-being. So it's not just about your cancer, it's those that are around you, those that are supporting you, and all the wave of emotions that you are going through when you receive this diagnosis. The other goal of palliative care is maintaining realistic hope. It is essential to achieving this quality of life. And as I mentioned, that the quality of life is different for someone. So for me today, my quality of life might be not feeling nauseous after having chemo. For somebody else, it might be having a wheelchair and being able to go to the beach when they were bedbound. So this is different for each person. Palliative care works in partnership with other professionals, providing support to patients and their loved ones at home, and working closely with your GPs, oncologists, and hospital consultants. It also aims to break down the silos that exist in patient care. You might ask, what are these silos? They vary from your GP, the very first time you're not feeling well or you feel that lump. And it can be more than one GP because you're seeking a second opinion. Then the next person is your surgeon who actually carries out the biopsy and delivers that diagnosis to you. And then from your surgeon, you refer to an oncologist. And then you're not happy maybe with the first opinion that the oncologist gives you, so you look for a second opinion. And there's your pharmacist, there's your friends, the advice that you get from them. And then there's also Dr. Google. And all of this information can be so daunting, so overwhelming, and for a lot of our patients, very confusing. It's, you're seeking help, it's helpful, it's important for your diagnosis, but it can be very overwhelming. So palliative care is appropriate from the moment of diagnosis, because you've got someone that you can sit with and chat with and then just work through all this different silos of information that you have received. It is holistic care, inclusive of clinical care, psychosocial, emotional, and spiritual care. And included in this care is bereavement counseling, as indicated. This graph will now just help to enhance and explain a little bit what do we mean about palliative care, hospice care, and bereavement. Looking at the arrows on the top, it says life-prolonging care. What is life-prolonging care? So here you're still having your radiation, your chemotherapy, and palliative care is applicable during that time. And then when those processes stop, your chemo comes to an end, or you decide to stop your radiation, then your palliative care is still continuing into your hospice care and even into bereavement. Bereavement is when the patient has already died. But this phase of palliative care is also pre-bereavement. And there's certain aspects and emotional aspects that you are assisted with through palliative care. So palliative care also aims to help patients live life to the fullest, positively influences the course of your illness. It is applicable early in the course of your illness and in conjunction with other therapies that are implemented to prolong your life, as I mentioned, chemo and radiation. This includes the investigations needed to better understand and manage distressing symptoms and clinical complications that occur during this time. The important thing for us, or like a take-home message for you today, would be buy-in from the patient and the family is so vital in order for you to get the most out of palliative care. And in essence, palliative care is when you just need someone to hold you up on your low days or on your bad days. On that day when you just feel like giving up, at least you've got someone that can help you to hold you up during that time. Just moving to the next slide. So what is hospice care? As you've seen on the graph, it's palliative care, and then the next phase of care is hospice care. So traditionally, hospice care is when all active treatments have stopped. What do we mean by this? So your tumor is growing, your chemo is not working, so the tumor is not shrinking. You decide that it's time for you to stop radiation because you're not happy with the side effects. They're unbearable. And then some of the medical treatments are withdrawn. Why are the treatments withdrawn at this time? It's because they are no longer able to assist in reversing the underlying condition. The focus shifts from optimizing comfort care for the patient and providing support for the family. Communication at this stage from all parties is vital, as the family needs to be ready to start the journey to facilitate a peaceful death. Some families battle with making this very difficult decision. And as Msunduzi Hospice, we always advise those that seek our services to come to us sooner rather than waiting till it's too late. Most of all, it's not about giving up because you have found hospice. Hospice is a big help to families as they don't have to handle the burden of caring for a loved one alone. I'll just make an example. Someone would phone us in May and say, my dad or my mom's been diagnosed with cancer, but they're fine for now. What is hospice going to do for me? So the biggest question and the common thing when someone picks up the phone or they hear about hospice is they ask, what exactly does hospice do? What are you going to do for me? So as Msunduzi Hospice, we provide care in the comfort of your home. And during this time of COVID, it is such a privilege for us to be welcomed into your home, so that we can be there to help make the most of this challenging time and make it a little bit more bearable for your loved ones. And especially now during COVID, there's a lot of underlying anxieties and families are reluctant to seek help. But with all the health and safety and infection control precautions that we have in place, we are still able to provide you that care during this time. So what do we do for you? We assess the patient's needs together with the family, and we plan ahead to manage any challenges that can be anticipated. We also insist you to navigate your illness the best way possible. And during this time, we are paying special attention and we give special consideration for the patient's wishes. Because as families, we may have other wishes and the patient may have something completely different, and we help bring those two together. We advise patients and families on writing a living will and assist with advanced care directives and a funeral policy. This might seem that when you're diagnosed, you don't want to think about a funeral policy. But time goes by so quickly, and a lot of families and the experience that we found that it's not something that is top on your priority on a day-to-day basis. So palliative care and hospice care, it just provides an extra layer of support through providing holistic care. So if everyone asks you, what does hospice do? We provide that extra layer of support. End-of-life care is a shift in your mindset. For those patients who are facing a poor prognosis, it is important to consider available options. Patients of medical age can access comfort care benefits that pay towards a caregiver. This eases the financial burden and allows families some respite or time out during this emotionally difficult time. So during this time, when a patient comes to end of life, care can be very taxing on the families. It can be expensive, and sometimes it's an unexpected expense, unplanned expense. So those patients that can afford to pay for their care, there is room for that. But generally our services are free, and then we are available for you, and the services are the same for both parties. This sort of advanced care planning aims to alleviate the fears and anxiety that are experienced in the last days, and they vary at each stage, and they vary from week to week. When patients are no longer able to carry out the activities of daily living, Msunduzi Hospice provides equipment to help improve care. Activities of daily living is when you're no longer able to assist yourself. So I'm sick, I'm not able to help myself to get to the bathroom, or I still want to take a shower, but I'm lightheaded, I'm dizzy, or there's no one actually there to assist you to help you to take that shower. So as Msunduzi Hospice and you want to become our patient, we have pressure alleviating equipment that's available to you to help prevent bed sores for your bed-ridden loved ones, hospital beds, and for mobilities, wheelchairs, a walker, And like I mentioned, if you're battling in the shower, we have shower chairs and a bath chair. So there's various support aids that can be used during this time and are available to our patients and our families. At the end of life, some patients, they stop eating. Weight loss is evident as the body starts shutting down. And we find that this can be very distressing time for the family. Because sitting around a table to enjoy a meal is what a lot of families look forward to. And when your loved one is unable to join you at the table, it can be very disheartening and very distressing. And that's where we come in to provide that support, and then you learn of the little things that when you're at this time that you start letting go. Treatments during this time are aimed at relieving unpleasant symptoms such as nausea and vomiting. And I think the most important thing with hospice care is that knowing that a loved one is not in pain is one of the most important goals. And I just want to touch a little bit on the myths surrounding morphine and the use of morphine. A lot of people feel that once you're on morphine, it's the end of the road. It actually isn't. Morphine can be used well and used correctly for long periods of time. And if morphine is used correctly and is used appropriately to control pain, it relieves your pain symptoms, it improves your quality of life, and that anxiety around having respiratory distress is decreased. So you're not issued morphine because there's nothing else that can be given. The other thing patients are afraid of, and I think more so the families, they feel that if the loved one is on morphine, they're going to become addicted. As I said, if morphine is given correctly, that is eliminated. And it is not a drug that leads to addiction. The other thing that is of utmost importance is keeping the patient comfortable. And that also is different from patient to patient and family to family. So hospice care helps curb the anxiety and avoid unnecessary hospital visits to preserve patient dignity in the last days. I mentioned earlier that one of the things that we do is that we speak to the families about the patient's wishes and respecting the patient's wishes. And you find that, and especially now during COVID, that maybe a brother and sister are here together, taking care of their loved one, and there's another sibling that is abroad. And you find that it's a sibling that's abroad that's dishing out instructions as to what needs to be done. We do not forget this time as to who's important. It's the patient and how they would like things done for them. I have a quote that I'd like to share with you. It says, right up until the last days of a person's life, palliative care is positive, it is planned, and it is purposeful. Factors that reduce quality of life are recognized, and we actively manage them. Planned and purposeful is that Msunduzi Hospice, we plan your care, what is best for you, and it is purposeful. So unnecessary treatments and, like I mentioned, unnecessary hospital visits are eliminated during that time, and especially during the last days, because it's about preserving dignity. Nobody would like to lose their loved ones en route to a hospital when initially they would say they would like to go peacefully in their bed. So when we reach the stage where the loved one has died, the family and the family goes through a phase which we call bereavement. And I mentioned earlier when we defined palliative care that pre-bereavement is part of palliative care from the time of your diagnosis. Some patients, as soon as they're diagnosed with cancer, they're already planning for the end. And having suffered this great loss, family will have to learn to adjust to living with this loss. And it can be a very lonely time. And once again, it can be a very confusing time and a sad time. And a lot of families are loaded with guilt during this time. So visiting a family after bereavement and during bereavement is an integral part of best practice of palliative care. So as Msunduzi Hospice, we keep in contact with the family for 3 months, making weekly contact with you during that time, and even up until the anniversary of the death, where you are still in our hearts, and the care doesn't just end because your loved one has passed away. Should the family experience complicated grief, we have social workers that specialize in bereavement counseling, and these services are available to our patients and also to the public out there. So I will hand over back to Warren. If there's any questions that are in the chat, we'll be happy to address them. Thank you.
Sheila, thank you very much for your input this afternoon. I invite people to raise any questions in the chat function, and we will deal with them as they come up.